My name is Liana D'Ambrosio. I am an occupational therapy student at Toro College in Bayshore, the School of Health Sciences. I'm in my final year, and in July, I will be a board-certified occupational therapist.
Awesome.
Thanks.
All right. So you and I were just talking downstairs a little bit about how assessing someone's condition or pain or problem they're coming in is more than half the battle to having the right treatment done on them.
Right. Mm-hmm.
So I just wanted to understand from the occupational point of view for therapy, what kind of different tests could you do to assess someone's hands, or specifically, let's pick a topic that people might encounter in the workplace, like carpal tunnel.
Sure. So like I was saying to you before, occupational therapy is primarily focused on function. So as you had been saying, let's just say someone, is injured or is diagnosed with something like carpal tunnel, they're obviously going to go to the doctor. They're going to, get x-rays. They might get an MRI. They're going to receive some kind of diagnosis. But that doctor is not going to focus on, well, how is it really impacting them? They're just looking at it from a physical perspective, like how it's really in their hand. So an OT will first of all do some measurements with a goniometer to see if they're within functional limits. This is all, standard numbers for degrees of range of motion. And then we would also test their muscle grade. So doing stretches, like I'll just demonstrate, like I might apply some resistance in their digits or in their wrist, doing things like wrist flexion extension, maybe some radial ulnar deviation. And then doing some fine motor testing. So some of those are the functional dexterity test, the 9-hole peg test, the O'Connor's dexterity test, the Purdue pegboard. So those are all basically it's like a board in front of you and there's objects. And we're timing them to see how fast they can pick the pieces up and put them back together. So there's norms of, times to determine if they're within functional limits.
So if we just break that down a little bit, what we're really asking someone to do is show us how well their hand or their extremity moves and how quick it moves with different types of physical activity. Right.
So obviously just picking something up, that's very functional because that could be, can they button, their pants? Can they zipper up a jacket? Can they pick a shirt up and put it over their head? Can they open a drawer? So that's really how we determine how that diagnosis is really affecting them.
And that's really interesting because most people are familiar with physical therapy and that they're interested definitely rehabilitating you and your muscle groups, but it's more looked at strength and flexibility. Whereas you definitely take that into consideration.
Yes,
we
do.
But the added component is what activities then can they do in their life, like buttoning your shirt or opening a door or maybe a work activity that they might be impeded or in pain on, whereas other therapies wouldn't look at that as closely.
Right. Yep. Exactly.
So you assess let's say someone has carpal tunnel. What might be an average or a standard kind of treatment for them? Or how they would present to you from an OT point of view?
Well, someone with carpal tunnel, their median nerve is affected. So
that's the nerve that's right here, right?
It goes along here.
Yeah.
So it innervates right here in the hand.
And that most commonly is the thumb, index, and middle finger. It could be more in half of the fourth finger.
Right, half of the fourth finger.
But it commonly presents here. And I think a lot of those people sometimes wake up at night or have trouble sleeping, and that's why they give them the braces.
Right. Yeah, the splints. So actually back to the assessment, there are also sensory assessments. So there's one in particular I'm thinking of. It's called the Semmes-Weinstein. I'm not sure if you've heard of it.
No.
So there's all these different like monofilaments of different sizes measured in millimeters. And the patient is supposed to close their eyes and all along the areas of where the median nerve innervates, we tap very lightly.
With what?
It's a monofilament.
Oh, so it's like a pointy wire?
Yeah, I mean,
I know what you mean.
Yeah, if you saw a picture, you would know what I'm talking about.
Yeah.
So that determines if their median nerve is affected. If they're not feeling something when it's getting bigger and bigger and bigger, then that's a sign, first of all, of carpal tunnel, but also that, their sensation is severely impacted. So, we could also do like a hot and cold test, like a fine touch, deep touch, sharp, dull. So sensation is definitely part of treatment. It's a very difficult part of treatment, I think, at least from my perspective, because it's not something that can be done in like 1 or 2 sessions. A lot of like soft tissue massage, definitely paraffin at the beginning of the session, maybe even an ultrasound, because that's really opening, the muscles up, and, they should be feeling it. They should be able to move their hand after receiving those modalities. Again, with stretching, even fine motor activities as they develop more strength. Typically, when a person is first diagnosed with carpal tunnel, we recommend that they don't lift over 5 pounds. That's usually what the doctor says. And, as they continue to see their physician and we get the clearance to do more activities with, higher weight, then we move on to that.
So just to recap that a little bit, the nerve. So a patient is feeling pain. They're in their 3 fingers, burning, tingling, numbness. Sometimes it's completely numb, and the complete lack of feeling is then also painful. And so that's sensory when you're saying that. And so they're not able to perceive the hot and the cold or the sharp or the dull. And on top of that, it can feel like pins and needles, like that tingling static sensation. So not only are you focusing on getting the movement back, but also changing that uncomfortable sensation back to normal.
Exactly. Yeah. And I mean, every patient is different. Some people might not, experience that severely where they can't actually differentiate between, certain objects or certain temperatures, but it definitely does impact, it impacts their sensation. Like when they're feeling something, even just putting their hand on the table, they might have like a rush of pins and needles going through them. Or even if they're just sitting, or typing on the computer, it might just be too painful for them to do that.
And now to get that sensory to change, to get those sensories back to normal, what you're doing there is stretching and ultrasound and a paraffin to loosen up the median nerve. Because what's actually happening there to the nerve? Is it contracting around it?
Yeah, it is contracting around it. It's open. Yeah. I mean, I guess it's difficult for me to describe because I'm still a student, so I haven't had enough experience with it. But my understanding is that, yeah, like the heat and along with the like chemicals that are in the paraffin, and it's also enclosed in saran wrap, so it's nice and tight. And usually a hot pack is put over it, so all that heat is really, opening everything up. So it should be looser and it should feel like.
See, I'm familiar with paraffin, like at like the nail salon or something, and I think a lot of people know that as like for moisture or moisturization of the hands or softening maybe of the skin. So what is that paraffin substance? And what you're saying is that it really gets the heat into the entire area?
Yeah, into the muscles and even really into the nerves.
Oh, awesome. All right. So then once you go beyond that, now you're going to be doing that therapy, stretching it open, I guess, and then performing different activities to test their progress.
Right. Like I can think of one patient in particular who I had seen over the summer. I did just that. I like everything that I've described so far, and I only had the opportunity to see him a few times because then my time there ended. So I didn't unfortunately get to see him, progress. But he was very limited at first. His hand was really like this. So we were focusing on just, first of all, opening the hand, then eventually getting him to grab something, then getting him to move things. I think he was very strong, so his strength actually wasn't really an issue to begin with. I think just naturally he had more strength than the average person. But eventually we would have, been doing things like heavier, doing things with more like fine motor, because I know that was something he lacked, that, picking things up, constantly dropping them because he couldn't feel it.
So every time this patient comes in for therapy, there's always a progression to treatment. It's not the same old thing every time.
No, definitely not. I mean, it could be the same activity, but it's just changed a little bit differently, like advancing, maybe this time we're doing 10 of something versus 2 of something. But yeah, definitely an OT, really with all patients, that we try to do different things every time we see someone. Otherwise, it's like there's no point, they're just learning how to do the same thing over and over again. And there's no real,
they hit
impact.
A plateau, right? So if they hit a plateau and And now I haven't been to an OT therapy center, but it sounds like you're there for the majority of the time with them.
Yeah, I was treating people I was there for 12 weeks, like this past rotation. I was really doing hands-on things from day one. I was, with my supervisor always, but towards, even after just being there for about 3 weeks, I was treating people for their entire sessions, doing evaluations, doing their discharges. So yeah, I spent a lot of time with them.
So, would a typical session consist, or a treatment consist of a full hour, or how long is the time duration?
It's about 45 minutes to an hour. Usually 45 minutes if the person doesn't want the ice at the end, or if, something happens that they can't stay the full hour. But most people, it's about an hour long.
Okay, so let's say 45 minutes to an hour. And then how much face-to-face time do they have with you providing the therapy? About?
Probably at least 35 minutes. 35 to 45 minutes, because, the heat, that's about 10 minutes. And then, the ice maybe at the end, if they get that 5 minutes. So yeah, it's pretty hands-on the entire time, unless, you're seeing a few different patients and, you have to give them directions as well. But the therapist is always there. The therapist is never just leaving them to, do whatever they have to do.
So you're there the entire time. It's a very active therapy between you and the patient, and you're constantly reassessing to bring them to the new treatment plan to advance the therapy that you're giving them, the dexterity to keep giving them the more challenging.
Right. So whenever a patient comes in for an evaluation, we always give them a home exercise program. Now, those exercises might be, stretches, or they could be actual like therapeutic exercises. Sometimes we're doing them in treatments as well, but then these are what we really want them to, enforce at home. That's really a critical component of OT, that a person, let's just say they're coming in twice a week for an hour. If they're recovering from whether it's carpal tunnel or a stroke or really anything, they're not going to benefit from only doing something twice a week for an hour. They need to do it every single day, and they need to be consistent if they want to improve, in a decent amount of time. So we do update those home exercise programs as the patient is benefiting, or if in some cases, if they're regressing, then we have to change something and see, what happened, what can we do differently? And reassessments do have to be done typically after every 10 visits.
Sure.
Usually, that has to do with insurance as well, that they require every 10 visits. But that would be, reassessing their strength, reassessing their range of motion, their flexibility. If it was a sensation, maybe redoing that Semi's-Weinstein test to see if they can now tolerate, lower monofilaments, sorry.
So like sharper filaments, right?
Yeah.
So just so that people understand that viewing this is that you're face to face with them for the half the session or more, working hands on hand, and you are doing somewhat of an evaluation every time you see them to see where they are, so that you can increase or advance their plan of care and the challenging activities. And on top of that, you're going to be teaching them their exercises at home to do, and they probably take anywhere from 10 to 15 minutes to do per day.
Yeah, sometimes even longer. It depends.
But maybe averagely 15 minutes.
Yeah, I would say average 15 to 20 minutes.
And you're going to teach them. You're probably going to give them a video or a pamphlet so that they can remember, because it's going to be the first time they're learning how to do this.
Right. Yeah. They have a handout, with pictures demonstrating exactly what to do. Okay. And it's written out how many times a day we want them to do that, and for, how many times per week. And then we always do a demonstration before giving it to them. And then we usually have them demonstrate it to us so that we know that they're aware of what they have to do.
I've even heard some offices have apps that they get on their phone, then they can see exactly what to do and for the prescription that the OT gives them.
Oh, wow. Yeah. I never heard of that, but that sounds like a great idea because, people are always on their phones.
Well, this has been very enlightening on what the difference between OT and PT is and what kind of advanced care that you give them. Thank you.
Thanks.